Hello, welcome to this episode of this podcast. Today we are here talking about a very popular subject, which is tooth whitening. Um, I'm going to start off by just making a little delineation, which it is important, but I think most people wouldn't know because it's sort of internal verbiage. I'm going to be talking about vital tooth bleaching, which is what commonly people know as whitening their teeth and getting them lighter. The reason I say that is because there is non-vital tooth whitening, which is when a tooth is necrotic or when it's dead, if you will. I nickname that zombie teeth. You know, if you've ever seen anybody or seen pictures of a front tooth that was very dark, actually looking back, I've seen pictures of Tiger Woods, I believe, had a tooth like that, and it was just a very dark tooth. It just looks out of place. That's usually as a result primarily of trauma to the tooth. A lot of athletes or anybody growing up, everybody's gotten hit in the mouth. So with enough trauma on a tooth, the tooth can actually die. The nerve can go necrotic, and over time, that darkens the tooth, and it becomes usually a brown or gray colored tooth. And that's a non-vital tooth. That's a tooth that actually needs treatment, such as a root canal, and we can whiten those teeth, but it's non-vital bleaching, and that's done from inside the tooth. You actually go inside the tooth and you bleach it from the inside out. So that's a completely different story from 99% of the population who want to know about generally how to whiten their teeth. So I'll start by saying age limits. I typically like I typically like the age of 16 being the cutoff. I have not read any studies or know of any direct reasons why children under 16 cannot whiten, frankly. But that's kind of been my guideline because I think that's when socially kids start to want to whiten their teeth. That's when boys start wanting a girl or a girl with a boy, whatever combination there. But that's when socially whitening teeth becomes more popular. So I think that sounds to me like an age where it's appropriate to whiten your teeth. Have I had children younger whiten their teeth? I'm sure they've gotten white strips over the counter and their parents gave it to them. And I've never had any problems with that. So some things to caution people that are out there whitening their teeth. Crowns and fillings and bondings typically will not whiten. These non-vital teeth, these zombie teeth, will not whiten at all. These teeth that are dark because of trauma. So be a little careful. If you are anticipating having white fillings or bonding or resin composite fillings done at your dentist, specifically on a front tooth, it's important to not whiten for at least 2 weeks before you do that because whitening actually inhibits the bond strength of bonding on front teeth or all teeth. But specifically on front teeth is the ones we worried about, and that's typically the over-the-counter products are on front teeth. So if you're a patient out there anticipating getting bondings done on your front teeth or any kind of a white filling, don't go use white strips up until you go see your dentist because it will lower the bond strength and they're more likely to fall off. So you want to have a 2-week break before that. The other reason for that is usually when you whiten, you have a little bit of a dieback, meaning if you whiten, let's say, 4 shades, or let's just arbitrarily say you go from shade 0 when you go to bleach number 3. And so what happens is after you're done whitening, you're at bleach number 3. Well, oftentimes it'll die back to about bleach number 2. That's just the nature of teeth. They kind of rebalance. So it's important to let that happen, and that takes about 2 weeks or so before you go see your dentist so that when they match your tooth, it will stay that way. Sensitivity, biggest issue I have. People ask about, will my teeth get sensitive? And everybody's a little different. I have people that can whiten every day and they never get sensitive, and I have people that barely come near the whitening and they get very sensitive. What's important to know is if your teeth do get sensitive, stop. Don't keep doing it. There is no long-term damage done. from whitening as long as you do it in moderation, like anything else. What I'll typically tell people is sort of an example. It's like cutting your nails. If you cut your nails every day, you're eventually going to get to the base of the nail. Now you're going to cut your fingers off, and that's going to be damage. If you cut your nails and wait for them to grow back and then cut them again, it's not really a problem, or cutting your hair or anything like that. So that's sort of a loose description that I give for people when they ask me about, can I whiten? How long can I whiten? Does it damage my teeth? There are some demineralization. There is some demineralization to the teeth that happens with the whitening. The enamel is slightly more porous during, but once you stop whitening, they just remineralize and your teeth are left a little bit whiter. So let's talk about the major ways of whitening. The most common is the over-the-counter. That's the dominant brand is the Crest White Strips. And I have a lot of patients, again, probably 70% of my patients use those. There's a new Crest 3D. There's also another one that a patient of mine told me about where you actually can stretch it over your teeth. And I had a patient recently really raving about those, saying they fit so great. The biggest issue with white strips is they're sort of a one size fits all. So I'll tell people, well, it's kind of like if I bought a pair of pants and I wanted everybody to wear them. Well, some people would fit very well. Some people it's not going to fit. It might be too loose on me, too tight on somebody else, too short on me. You get the picture. So these white strips are sort of a cookie cutter shape for the majority of people's teeth. And so if you don't fit in that majority, if your teeth are bigger or smaller or crooked or whatever, they're not going to fit very well. So this latest rendition of white strips is something where it stretches really well, and apparently it molds very, very well. The next step is sort of a semi-custom. That's usually an office product that's sold at a dental office. Most recent common one is one called Opal Go, OPAL-Go, made by a company called Ultradent, ULTRADENT. This has been a pretty favorite product. It's a little bit stronger than the white strips as far as the gel. And instead of having it as a strip, it's sort of like this wax, if you will, mouth guard, and you sort of shape it to your teeth. So it fits pretty well. I've tried it. I like it. I actually use it. That's actually my product of choice currently, because I can take them with me and use them, and you throw them away. It's kind of messy when you take them off. I have to say the wax kind of gets everywhere. So you have to make sure you have a toothbrush handy when you're using it, because when you take them off, there's wax and gel everywhere. It's not something that you can just take out and spit out and go into work, because you're going to have to spend some time brushing your teeth afterwards. So that's something to consider, but it is a good product. The next one, which is probably the most common one, is a custom bleaching tray, which is when we take molds of your teeth and we make you a very thin, usually it's about a 0.5 millimeter or a little bit thinner than a 0.5 millimeter, clear plastic tray that fits. It's almost like saran wrap on your teeth. You generally don't even know it's there. You can, for the most part, talk pretty well. And you load the gel. You buy the tubes of gel and you load it in there. And you wear it overnight, or you wear it for a few hours, depending on the strength of the gel. This is probably the most predictable of the options, meaning it works for everybody. I have not had a set of these custom trays not work, because they are custom to you. They stick onto your teeth very well, and as long as you put the gel in there, which it's almost foolproof, it's going to whiten your teeth. Very, very predictable. As long as your teeth don't change, you can have those trays forever. Cost-wise, you're looking at usually moderate $200 to $400. I'd say maybe $500, somewhere in that range. But it's a few $100s. It's not thousands of dollars. The next one, which is probably the most advertised, is the power bleaching or Zoom or in-office bleaching. There's different renditions of this. This is basically when you go to the dentist and they put this super high-powered or very high-powered gel on your teeth. Sometimes there's a light that activates it. Sometimes they're activated other ways. But point is, this is something that's done in the office. You have to put different barriers because the gel is so powerful it could burn your gums and your lips and all this kind of stuff. I have used these. I'm not a big fan, mainly because of this. the results and the side effects are not equal, meaning you might whiten a little bit more in that hour or in that 2 hours than you would in a week of the home trays or whatever other method. But the sensitivity and the problems and the burn potential is so much higher than the increase in the results. It's not worth it to me. I've had a few occasions where I'm doing that and the patient's just dying in pain. They're tearing it all off. And it's sort of a little bit of a scary thing because the patients can't close. They have all these dams and lip retractors that keep their mouth open, keep their lips away from the gel. And the gel has to be carefully put on there, and you have to put this special barrier on the gums. And man, it's tough because you may not be in the room, patient's in pain, and they're trying to scream for you, and eventually they'll get, somebody will check on them, and they'll see somebody's in distress. And it's kind of a stressful occasion, and frankly, a lot of times they have high levels of sensitivity. They can, not all of them do. And it's not worth the added risk, in my opinion. Now, there's a lot of dentists that do it all the time, and they swear by them, and I do think it does give you a quick result. So if somebody says, well, I'm getting married tomorrow, I don't have a choice. Well, yeah, that's kind of what you have to do. Price is a lot of times $500 up to $1,000. Another thing that a lot of dentists do, which I personally do too, is if you're doing one of these, I will go ahead and make you the custom tray so that if you have problems and if it's very sensitive and you have to cut the treatment off, let's just say instead of an hour, you can only take it for 15 minutes. Well, gee, then the patient says, well, I paid you $1,000 and I only got a quarter of the treatment. So I'll send them home with a custom trays, or I'll send them home with an Opal Go kit, and I'll say, okay, well, finish off what we didn't finish in here. But I'm pretty clear to patients that want to get into this power bleaching that there are some risks involved. Like anything else, if you're trying to do something very quickly and take the proverbial shortcut, sometimes there are some drawbacks there. So I hope this podcast helps anybody who's considering whitening their teeth. Thank you.